So my name is Stephen Kwatin Yeboah. I'm the managing director for OLEA M&G. And in OLEA is a big Pan-African insurance broking network. So we are located in 26 countries, Ghana included. So we have chosen as our project the promotion of breast cancer awareness. So every year in October we do this. And we have chosen breast cancer because we feel that our mothers are very important in society. When our mothers are not there, the whole family is affected. And we believe that breast cancer is on the increase. It's taking a lot of lives away. So as OLEA, we've seen this as very important. So we've taken it upon ourselves that we will spend this money to do this breast cancer awareness, to provide free screening, provide education, and also to support people who are even diagnosed of cancer. So after the screening, those who are diagnosed, we are going to sponsor them to get treatment. And it's our way of giving back to society what society has given to us. Because without society, we are nothing. Every single cedi we earn as commission on the insurance policies that we sell, it comes from society. So it's our way of giving back to society. That's why we are having this breast cancer awareness screening. Yeah. This is the third year of having the screening. Last year we went to Adabraka Pass, and this year we are here. The previous year we did an in-house hosting at Aliza Hotel. So people came to Aliza Hotel and then we did the examination. So it is our third year of doing it, and it's come to stay. Every year we do it. And every year we also make donation to Jihad Foundation, which is a breast cancer foundation dedicated at providing care to breast cancer. So before this, the past 6 years, we make donation to the foundation to support the treatment of people who are diagnosed with breast cancer. So OLEA has come to stay. OLEA is actually the first insurance broking company in Ghana. We were established way back in 1969, and we have come to stay. This breast cancer awareness has come to stay. Every year, we will be dedicating a percentage of our turnover towards this. So what it means is that we are not just going to end here. We will continue to expand what we are doing, and we'll provide care to as many women as possible. And we want to encourage all our women that please take advantage of these initiatives. Come and have your breast examined. Let's have early detection, and let's support, even if the unfortunate happens that you have the cancer, we are told that early treatment can cure it. So the way forward is that it has come to stay, and we are going to do that. So Pink October with OLEA is come to stay. The Adabraka community, you can see that the patronage has been massive. We want to thank the chief of Adabraka, the Queen Mother Association, their leaders and all of them. We want to thank them for welcoming us to this community and for patronizing. We're overwhelmed with the number that we are seeing here. And we want to thank them so much for giving us this warm welcome. So thank you.
Camille Fair-Morton. I am a U.S.-trained nursing professor, and today we're going to talk about breast cancer prevention and breast cancer screenings. Breast cancer screening is very important because during the early stages of breast cancer, there's a lot of treatment that's available to patients, but as you progress to the latest stages, there's less options available. Breast cancer in its early stages could be treated and oftentimes cured in the earliest stages, but as you get to the later stages, it's more possibility of metastasis or spread to other organs. So that's why it's important that we want to educate women and men how to do breast cancer screenings today. So I have a breast here, and we want to recognize some of the signs of breast cancer. So when we do a breast exam, we want to encourage the women to do a breast exam once a month, usually after their menses or before menses, their choice. But what we're looking for is any kind of rashes on the breast, like this red rash that we see here. It's called puer de l'orange or orange peeled skin. If a woman sees this rash, they need to go contact a medical doctor to get a further breast exam. So any abnormal rashes could be a sign of breast cancer. It's not always, but we want the woman to recognize it and go get further workup. Also, if you recognize there's lumps in her breast, some lumps are normal, but we don't want women to think it's normal. Usually a hard, non-movable lump is abnormal sign of breast cancer. We also have something called dimpling, which is when you see this space dimpled inside the breast tissue. That can also be a sign of breast cancer. Sometimes we'll have discharge from the nipples, so we want to make sure women who are not breastfeeding do not have discharge from their nipples. Another thing we want to also look at is what's called nipple retraction, where the nipple is inverted on someone whose nipple is not usually inverted. So we want to educate women to recognize the signs of breast cancer so that we can have early treatment, so we have less deaths from breast cancer and more treatment, because it can be treatable if it's caught in the early stages. My advice to the general public is to make sure we're doing breast self-exams every month, and if you feel something abnormal, which is some of the signs that we talked about, I want you to go see a doctor, because it becomes more expensive as the cancer spreads, and it's easily curable in some stages if it's caught early. So I want us to make sure we're doing a breast exam every month and recognizing these early signs of breast cancer. Thank you.
It's good to screen. As we as a market women, sometimes we don't have time to go to the hospital. So as you people have brought it into our doorsteps, it's good for us.
So what are the training you've gotten this morning?
Okay, they've shown us how to massage your breast to see that whether you have any effects in it.
So you advise to other women?
Yeah. As I have finished when I get into the market, I'll tell my colleagues to come and check. Or they should, every month they should go to hospital to go and check. The doctor said, they say maybe you drink, you take alcohol, you smoke, and it can also let you get the breast cancer. We thank them a lot. May God bless them. They should always come closer to us, especially the market women that we don't get time to go to hospitals.